The value of good nutrition for non-Hodgkin's lymphoma patients. A commonly known cancer is Hodgkin's lymphoma, but one that is even more common is non-Hodgkin's lymphoma, a cancer that develops in the lymphocytes, certain white blood cells. The risk of developing non-Hodgkin's lymphoma increases with age, and is even more common in people over the age of 60. However, this is a cancer that knows no age limits, and is found in patients of all ages. Early detection is extremely important when it comes to the treatment of non-Hodgkin's lymphoma, and testing must be done, as this is a disease that is easily mistaken with other illnesses. Some of the symptoms of non-Hodgkin's lymphoma include swollen lymph nodes, weight loss, fever, night sweats, fatigue, abdominal pain, chest pain, coughing and other breathing issues, and very itchy skin. Risk factors of non-Hodgkin's lymphoma include organ transplant, use of immunosuppressant drugs, AIDS, exposure to certain chemicals, that is insecticides, and infection with Helicobacter pylori, which causes ulcers. Diagnosis and treatment of non-Hodgkin's lymphoma. There are many tests that can accurately diagnose non-Hodgkin's lymphoma, including X-ray, CT scan, MRI or PET scan, physical exam, blood tests, biopsies, including bone marrow, and urine tests. There are about 30 classifications of non-Hodgkin's lymphoma, with stage I the earliest and easiest to treat. Treatments for non-Hodgkin's lymphoma include chemotherapy, radiation, stem cell transplants, surgery, as well as biotherapy and interferon therapy. Biotherapy involves the use of several medications in combination to treat the disease. Interferon therapy uses interferons, proteins, that fight viral infection. Non-Hodgkin's lymphoma treatment should include a healthy diet. Just like in the treatment of any health condition, a healthy diet plays a vital role in the treatment of non-Hodgkin's lymphoma. This is a disease that will attack the body when it is vulnerable, especially when the immune system is low. One way to maintain a healthy immune system is to eat a healthy, well-balanced diet that is rich in protein. A physician will be able to help non-Hodgkin's lymphoma patients choose a sensible diet plan that is well suited to their needs. This diet must include proteins, fats and carbohydrates in the proper amounts. Fats, even though we hear so many stories about how unhealthy fat is, it is actually a necessity. Healthy fats are those that are rich in omega-3 fatty acids and can be found in cold water fish, including salmon, as well as olive oil and nuts. Carbohydrates, carbs are also avoided by many dietaries, but the right carbohydrates are necessary for a well-balanced diet. In fact, carbohydrates are the primary source of energy for the body. Complex carbohydrates are healthier, as they digest slowly. There are a number of healthy, delicious sources of good complex carbohydrates, including vegetables and whole grains. Proteins are a macronutrient that the body depends on for survival. Proteins are made up of chains of amino acids created from nitrogen, carbon, oxygen and hydrogen. Healthy proteins come from both plants and animals. Animal proteins, except soy, which is a complete protein, are the best since they contain all 8 essential amino acids and all 14 non-essential amino acids. Protein supplements. Many non-Hodgkin's lymphoma patients find that they are not getting the amount of protein they need in their diets. Protein supplements are often recommended. Many protein supplements, including ProfectR by Protica, are fat and carbohydrate-free, and are low in calories. ProfectR is a non-filling 2.9 fluid ounces serving, and although it only has 100 calories, it is loaded with 25 grams of protein. ProfectR is available in a variety of delicious flavors including blue raspberry, grapefruit mango, fuzzy peach nectar, cool melon splash, passion fruit and fresh citrus berry. Protein powders are also popular because they can be added to just about any recipe, including shakes and smoothies that make delicious meal replacements. Most healthy diets include between meal snacks, and there are a number of great-tasting protein bars and other snacks that are made just for this purpose. They will provide the protein that patients need in addition to a boost of energy. Protein powders are available unflavored to add to recipes or for drinks. They come in delicious flavors such as chocolate, vanilla, berry and fruit punch. There are a number of different protein supplements available, including powders, liquids and capsules, and they are made from a number of natural protein sources. For example, many protein supplements are made from whey, which is a milk derivative and a byproduct from the cheese-making process. Whey is a complete protein and is very easy to digest. Another complete protein is soy, which is extremely popular. People who have food allergies and sensitivities may want to try protein supplements made from rice proteins, which are considered to be hypoallergenic and are also complete proteins. Jason, a case study. After being diagnosed with non-Hodgkin's lymphoma, Jason's physician put him on a treatment program which included chemotherapy and radiation followed by a number of drugs. After a few weeks, Jason noticed that although he wasn't feeling any worse, he certainly wasn't feeling any better. He was sluggish and didn't have any energy at all, not even enough to perform his daily routines. During his next visit with his physician, Jason mentioned how he was feeling and asked if his was medication causing this and how it could be overcome. The physician recommended a high-protein diet, because it is not only great for muscle recovery following surgery and illness, it is also a terrific source of energy. The physician sat down with Jason and set up an ideal diet plan for him, which also included protein supplements, such as ProfectR and ProsisR. After a few weeks of being on this new diet, Jason began to notice that he had more energy, and that he was actually starting to feel better. He told his physician how great he was feeling, and said he wished that he had learned about eating healthy and using protein supplements a long time ago. Jason still uses the supplements in his diet, and is becoming stronger every day.